Okay, welcome to our shoulder anatomy part 2. Last week we reviewed the joint, bony, and ligament anatomy of the shoulder, and today we're going to go over muscle anatomy, origin, insertion. Not in too much detail, but just to review where the location of the muscles are and their action on the shoulder. And depending on how we do time-wise, we might just kind of stop after muscular review because there are a lot of muscles and they're all very important. So we'll just quickly review the superficial muscle anatomy. So anteriorly, we have some big players of the shoulder. You can see the pec major here with its clavicular head and sternal component, the big deltoid, which has the front, middle, and back fibers, or anterior, posterior, biceps brachii on the front here. And then some of the neck muscles. I'm not going to get into the neck or the spinal muscles, but we will go over that when we review the thorax. And then posteriorly, we can see another big group of muscles, the traps with its upper, middle, and lower fibers. Here's the back of the deltoid with the middle and posterior fibers, the lats coming down to the pelvis, and then the triceps, of course. Just to kind of look at some of these bigger muscles kind of isolated, you can see the deltoids, 3 different fibers, and there are different kind of attachments on the scapula. And then here's the upper trap. Again, I'm not going to go too much into the traps, but then here's the lat muscle coming all the way down through the back and then inserting to the front of the humerus. Pec major here, lots of fibers originating from the clavicle, sternum, ribs, and going into the front of that humerus. So as you can see, there's a lot of muscles going into the front of the shoulder, into the arm bone, and lots of different tendons that can get a little tricky when treating the shoulder. Okay, here's some of the deep muscles to be aware of. So on the front here, so we've peeled back the pec major, we've got the pec minor, which we'll go into a little bit of more detail later on. Underneath the scapula is the subscapularis. We've got the coracobrachialis, so we've peeled off the biceps brachii, we've got the smaller coracobrachialis, and then the brachialis, not a true shoulder muscle, but important to see it there in relationship to the biceps. And then posteriorly, we've got a lot of the rotator cuff muscles, supraspinatus, infra, teres minor, teres major, and then what we won't go over, the rhomboids and some of the neck muscles. Okay, origins and insertions. The biggest thing I want us to take from this is where the tendons will be when we're palpating or when there's pain, or for some of us manual therapists, for shockwave purposes, because we want to get where they're inserting into the bone. So just a general review here. Anteriorly, we have a lot of things going on here. Blue being the insertion, we'll kind of focus on that more because that's where the tendons are going to be kind of like clustered in the shoulder. So here's just an overall overview of where the origins and insertions are, and then I've highlighted some of the big ones here. So pec minor going into the coracoid, we've got supraspinatus up here, subscapularis coming from behind or the inside of the scapula into the front of the humerus. We've got the lats inserting to the front of the humerus as well, teres major coming from the back to the front, and then pec major, a big muscle covering over the anterior chest, inserting lower down on the humerus than I think we would expect it to be. And then we'll kind of look at those here. So Um, our pec major here, you can see the tendon's quite low on it on the humerus, and then pec minor here coming up into the coracoid. Look at that subscapularis, so it's underneath on the inside portion of the scapula and coming to the front of the shoulder. That one's going to be really important for inside the shoulder joint and kind of getting in the way there. And then here's that pec major with all the different fibers, kind of just reviewing. That's a thick tendon there coming into the humerus, and it's a bit lower than expected to be. And then here's some of the other ones. So I pointed out the lat being on the front of the humerus, big muscle, all pulling into the front. And then teres major here, important to note that it's coming from the back of the scapula into the front of the humerus. And then here's just a little bit of a zoom in on some of those muscle insertions. Supraspinatus to the top of the humerus. Here's that subscap again. I believe that's, well, it's not subclavius, it might be another portion of the subscap. And then teres major kind of gets a little caught behind there, but okay, posterior origins and insertions. So it's kind of important to note that we had a lot of anterior insertions, even of a lot of the posterior muscles. So it just gets really tricky in that joint. So you can see again supraspinatus at the top of the humerus here, infraspinatus coming into the outer portion but staying posterior, and then teres minor. Versus teres major was coming up into the front. So we're doing a lot of shockwave through this posterior, through this lateral shoulder. Really important to know these bony landmarks so you know what tendon you're targeting, because that's when you're going to get the highest benefit from a shockwave treatment, or even like a laser or something like that. Something I found interesting was how low the deltoid muscle inserts onto the humerus. So if shoulder pain is a little bit lower, keep an eye on that deltoid muscle. Yeah, just lots going on here. And then I pull up some of these muscles again. So infraspinatus, teres minor, all in the back of the shoulder here. Why did I pull this up again? I think I just want to show the deltoid again here. Yeah, just lots going on, but mostly with the rotator cuff. So specifically the rotator cuff. The idea of the rotator cuff is to compress the humeral head into the glenoid fossa with movement. And what that does is it allows for smooth gliding and to keep that humerus in place so it's not translating. So when I did part 1 of shoulder anatomy, I mentioned that the capsule is actually a loose fibrous tissue, so it's not as secure as we need it to be. So this rotator cuff is essential for keeping that humerus in place so we don't get any subluxations or any instability in the front or the back of the shoulder. So specifically, the supraspinatus is limiting the humerus from translating upwards. The infra and teres are limiting upwards and backwards translation. And then the subscapularis is limiting frontwards and upwards translation. So having a strong rotator cuff is really important for making sure that shoulder's not moving too much. So oftentimes manual therapists will do a lot of like gliding motions through the humeral head to see if it's shifting too much in one direction. That could mean an imbalance or an overuse on one side more than the other. And then yeah, you can just see here in the shoulder joint that supraspinatus is really in tight quarters with the acromion and the clavicle. So not a lot of space under there. And when we go over injuries, we'll definitely look at this in more detail. But you can see how these tendons really get caught up around the humeral head and the joint itself. So just knowing where they are and understanding if they're on the front or the back, or their importance with the humeral head. And then I wanted to point out the teres major again. I already kind of mentioned this, but teres major is inserting to the front of the humerus, while teres minor, which is one of the rotator cuff muscles, is actually on the posterior aspect of the humerus. So just kind of knowing where they are in school, we learned that minor is over major. So minor is above major, and that applies to rhomboids as well. And just to review, rotator cuff is the supraspinatus, infraspinatus, and teres minor as the external rotators, and subscapularis as internal rotator. Pec minor is important to review. Although a small muscle, it has a very complicated position in the joint as well. So it's originating on ribs 3 to 5 and inserting to the coracoid process, which is a very complicated area of the shoulder. And then you can see in this picture on the right here that there is a lot of neurology, a lot of vascular components underneath it. So just knowing where that tendon is and how it could be a player in it. You've got the pec over that. You've got subscap tendon coming underneath it. It's a complicated area for sure. And then actually you can see the subclavius underneath the collarbone there. I think it can be a missed muscle, but it's inserting onto that, or originating on that first rib and inserting into the clavicle. So might be important for first rib pain or for anything clavicular. And then here's just a reinforcement of how those rotator cuff tendons can get really compressed in the shoulder joint. So we've got the subacromial space with the supraspinatus, we've got a bursa in there right above it. As soon as that space is compromised, or as soon as you've got strength on one side of the shoulder over the other, it's going to start pinching through there. And then here's the long head of the biceps. Remember that inserts into the labrum at the glenoid fossa. And so another thing that can get pinched, another thing that can be inflamed. And then, of course, the short head would be going over to the coracoid process. And then I pointed out the subscapularis here and just how it comes right in front of the shoulder there. Can be important for anterior shoulder pain involving the capsule and the subscap. Okay, we'll leave it at that, and we'll come back to muscle actions on our next week. Thanks for joining.